to use this sacred space. You really get a sense of connection to the history just by being here in this beautiful chapel. Glenn spoke about some of the challenges that are ahead and how the community's needs are changing. As an organization, Providence Care is also facing changes. Change has always been a part of our culture. We continue to seek ways to deliver our mission and to serve the most disadvantaged in our society. We began a process for change to our hospital services over 12 years ago, and we celebrated our 150th anniversary this year with the announcement that our new hospital was approved. The new building will bring together the programs at Mental Health Services and St. Mary's of the Lake. For the first time in our history, we'll have a single hospital site for rehabilitation, palliative care, complex continuing care, specialized geriatrics, and mental health programs. The new hospital will present opportunities for us to make changes to how we deliver our services. We're already talking about how being on one site will allow us to do things differently. As Glenn has mentioned, which I believe is very important, the new hospital will help reduce the stigma attached to mental illness as we integrate our patients and clients and remove the present facility that has long been associated with mental illness here in Kingston. Building a new hospital is a once-in-a-lifetime opportunity and a privilege. But we're also planning for the future of Providence Manor and the possibilities for redevelopment that will improve the physical environment for our long-term care residents. In addition, many of our community programs are involved in initiatives to enhance and build on their services as well. For example, we are working with the Southeast LHIN on a project to provide supportive housing in Napanee for clients with acquired brain injuries. We are implementing the Behavioral Support Services Program, a new community service to support seniors and long-term care homes and their residents who are dealing with difficult behavioral situations. I look at the long list of initiatives and priorities Providence Care is working on today, and I have to smile. We are making a difference. We are a committed community that is on a mission, our mission of enhancing the quality of life. That is why it is so important for us over the past 11 months to be reflecting on our 150 years of history. Over and over, we have reminded ourselves of the story of the four sisters who arrived from Montreal and immediately began caring for the disadvantaged, although they had very few resources and virtually no established network of support. It is our commitment to stay true to our mission and values that will help us move forward. I have tremendous confidence in our staff and in Providence Care as an organization that we will remain committed. I feel confident because of the feedback I hear from patients, clients and residents, their families, and our staff. Our satisfaction survey scores are consistently high, even at 100% in some areas. And like Glenn, I have heard it directly from the people we have served, how staff go above and beyond to meet their needs. I have received letters from families who have said there is something different about the care at Providence Care. One family said it was as though angels were there caring for their loved one. Our staff, physicians, volunteers, students, board members are committed to meeting the physical, emotional, social, and spiritual needs of each person. We are committed to our values of respect and dignity, compassion, stewardship, which is the foundation of our culture. This commitment makes the difference. As we look forward to the next 150 years, Providence Care is likely to change in many ways. However, what will stay the same is what has stayed the same since 1861. Trusting in Providence and strengthened by the spirit tradition of our founders, the Sisters of Providence of St. Vincent de Paul, we enhance the quality of life by meeting the physical, emotional, social, and spiritual needs of each person. We work with our partners to innovate and excel in education and research. We treat each person with respect, dignity, and compassion. Thank you.
As we wondered together across Providence Care, how might we celebrate this 150th anniversary? Many ideas came forward. One of those ideas came from Fran Cooney, who has been an employee with our organization for 30 years. She and her good friend Linda Miller love quilting. Today, I'm going to call Fran and Linda to come forward to the front. And I'm also going to ask if the chair of our board, Glenn Wood, and also our CEO, Dale Kenny, would also come forward, because we have a gift that we would like to give to the sisters. And I'm going to ask if the Leadership Council, the leadership team for the Sisters of Providence of St. Vincent de Paul, could also come forward and stand down there, just in front. And we have a gift that we would like to give to you.
So I just wanted to, on behalf of Providence Care, thank Fran. As Neil said, Fran's been part of our mission at Providence Care for over 30 years, and with her friend Linda, they have created 5 quilts, and they went through quite a process to do this over the past year in garnering ideas from our staff and across all of our departments, and they've just done a tremendous job with each of the quilts that will be displayed in each one of our facilities. So I just want to thank Fran and Linda for all the hours of service you put into these quilts, and they truly are a great momentum of our 150th anniversary. So thank you.
On behalf of the sisters, words just don't come. It's so beautiful, and you've just captured the whole history in one quilt here. It is lovely. The houses, I hope everyone will get it. You will get a chance, I think, to see it up close in a while. So thank you, Fran. Thank you, Linda, for the hours of work you put into this. And okay, Fran's trying to tell me that it was really Linda who did it, but it was Fran's idea. That's right. So once again, thank you so much, and it'll certainly hang in a place of honor at our Mother House.
And while we are all still here in place, there's something else we would like to do. Fran and Linda have very creatively created 4 more quilts. They will be hung in each of our sites. One will go to Providence Manor to be hung here. One will be in St. Mary's of the Lake Hospital. One will be at Mental Health Services. And then there's another one which has squares upon which each program and different people throughout our organization have written or placed a symbol that has all been quilted together, representing our wonderful family of Providence Care. And that one will travel from place to place. We want these quilts to hang there representing the spirit of Providence, and we ask that the Sisters of Providence would please bless them, so that when they are then presented and unveiled in each of our facilities during the week of December the 13th, they will come and be hung as a representation of the presence of Providence and of our founders. So I'd like to ask the Leadership Council if you would come forward and offer a blessing upon each of our quilts.
So I'm going to bless this quilt, which is going to one of the healthcare institutions. As in the past, Providence has provided for those most in need of care. We bless this quilt to serve as a reminder for the future that Providence will guide and will provide. And for another institution. As in the past, Providence has provided for those most in need of care. We bless this quilt to serve as a reminder for the future that Providence will guide and will provide. I wish I knew which place these were going to, but I don't, but it's okay. They will get to the right place at the right time. So again, little quilt. As in the past, Providence has provided for those most in need of care. So we bless this quilt to serve as a reminder for the future that Providence will guide and will provide. And finally, as in the past, Providence has provided for those most in need of care. We bless this quilt to serve as a reminder for the future that Providence will guide and will provide.
Thank you. Please be seated.
Let us pray. Provident God, source of life, we offer our gratitude for your faithful guidance and provision through the past 150 years, during which Providence Care has served the people of Kingston. You looked with compassion upon orphan children, imprisoned women, and hopeless and dying men and women. You heard the prayers of the people and of the church. We offer you our thanks